My secret, just do something that ain't nobody ever done before, but make it sound like something that's always been there forever.
Welcome to This Filipino American Life, a podcast that explores the nuanced experiences of Filipinos in the United States at iba pa. My name is Joe Bernardo, and I'm joined by my fellow hosts,
Ryan Carpio,
Elaine Delalis, and a special featured player guest host,
Kat Carrito Bonds.
and
Mike.
yeah, producer Mike.
oh, that's loud.
Oh my God.
Great.
That is
actual
super loud.
air horn. Yay!
Yay!
So hopefully for listeners listening to this, we are using a new platform, and hopefully the sound quality is a lot better.
And those air horns are probably a lot clearer than you were used to hearing, for better or for worse.
So thank you to TFAL Priscilla Hung for being able to facilitate us trying out new technologies.
Oh, Priscilla.
Cool.
Oh, you actually know her.
Yes, I do. She's part of a giving circle that I'm part of.
Oh, sweet.
Priscilla.
Yeah.
Thank you
Priscilla.
for giving
Hello, thank
to
you.
the API Giving Circle and giving to TFAL.
Yes. Thank you, Priscilla. What are we talking about today, Kat?
Since we're coming up on a year now of being on a lockdown. That sounds so extreme. Is that the official term? Or safer at home? Isolation due to COVID. We are having COVID conversations with a medical professional in our community.
Oh, that is not me.
Not you.
That is not me.
It's not any of us.
Yes, we are talking to Cindy Evangelista. She is a physician's assistant and a community advocate for the Filipino American community. But she'll talk about kind of her perspective on COVID and some safety precautions and kind of just what we all need reminders of during this pandemic. But while we are still approaching, year one in our pandemic, how are you all doing? And what is one thing that COVID really affected in your life this past year? I tag Mike.
Damn it. It definitely affected my social life. Just because, going into the office, hanging around with coworkers, getting drinks afterwards, or just having dinner with friends, visiting people. All of that has gone down to not nothing, but next to nothing, right? Because I want to stay safe and not be around all the the COVID
Riff
germs
raff.
out there, the riffraff.
COVID.
But it's definitely changed the way that I've engaged with people. Because everything is with us right now is virtual, which for someone who's as introverted to me has sometimes been good, but also has sometimes been just really bad because it just feels so isolating.
Mm-hmm.
And so there's things that I miss about just sitting in a cubicle and being able to just have conversations with people and coworkers and and to not be able to do that anymore makes work feel different, makes just my social life feel different. And on the flip side of that, I feel like I've talked to my parents more than I've ever talked to them before because we have weekly check-ins. Whereas before COVID, I'd talk to them maybe once a month at best, maybe less than that. But now we have a scheduled call every Sunday in the mornings just to see how everyone's doing, and sometimes it's a little much for me because I'm not used to that much interaction with them. But no, at least it makes me feel better knowing even though they're kind of wild in the streets compared to us, at least I know that they're okay for the moment. So
So yeah, I think there's always silver linings in everything,
Yeah.
right? Even in this time. Kat.
Oh gosh, I do. Well, for me, I miss my parents. We've just not having seen them as much, just out of safety for them. Because my mom's a cancer survivor. My dad had a really bad bout with pneumonia a few years ago. So, we just want to be extra careful. So I do miss seeing them. But I will say our text messages have gotten a lot more fun. So I appreciate that. I also felt like I worked more because I showed up right at 9 a.m. or, starting time.
Oh my God.
And so
Kat's on time to something.
I'm not late. And,
Blast.
Hey, sometimes I would, Girly and I would just have, we just happened to make a quick stop at Brooklyn Bagel, so we had reason to be late.
You did, huh?
We did.
Oh.
Or the bakery on Glendale. God, she loved it with all the croissants. Anyway.
Oh my gosh. I'm going to...
Yes.
I know her secrets
good.
now.
No,
And then when we were late, we would bring it for our coworkers so they would love us. Anyway. So yeah, but I will say that I felt like I work a lot more. That's definitely affected, but also too, I'm really appreciating the time spent with my family, with my child and with my husband, because we just see each other more. And I think we've learned, I'm sure there are times that they're very frustrated with me, but I've noticed we've just been a lot more caring and loving and just being closer to each other. It's not all perfect. There are times where we probably want to strangle each other,
Right.
but I do appreciate the time because I get to see them more, and we're not ripping and running all the time, and I get to see my Kaisa grow. So very thankful for that.
Elaine.
I used to be somebody that didn't mind a crowd. I loved going to Disneyland. I was an annual pass holder. That was my jam. Being in the
anymore.
parks. And I'll be honest with you, the whole idea of being in an amusement park gives me anxiety that I cannot. There's not enough CBD in the world for me to relax in that scenario. And if I am anywhere near a crowd, I am totally that tita that stares at you and is get the fuck off me. Get back. You too close, man. You're too
Right.
close.
You mean Tita Elaine?
Exactly.
Yeah.
But before I didn't care. I wouldn't mind being in crowded ass Disneyland. I knew how to weave. I'm the slowest walker ever, but put me in a crowd at Disneyland, I will get through that like no one's business. I can get to Main Street to Toontown in 5 seconds. I can do that in a crowd. Now though,
know what that means.
oh my God, I would probably cry. Why are there so many people here? Stay 6 feet away. I don't know where you have been in your COVID germs. So I think I have changed from an extrovert to more introvert, ambivert. I'm just stay the F away from me. I don't want to talk to you. It's too hard. And so that I think is the biggest change for me in that crowds. No, how you and Vanessa really love going to Costco. That shit stresses me out. I don't like going to Costco. I will only go if I really, 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 really need a giant pack of shrimp noodle wonton soup or something. I don't need that now. My freezer can't hold that. But yeah.
Yeah, we strategically choose weekdays and times that we that it's less, and we don't go to the Alhambra one ever.
Yeah, don't go to COVID. We don't go. I can't go to the Atwater Costco because of the COVID rates. There are certain Targets I don't go to. There are certain Costco's I don't go to because they're always on the LA County COVID list. So I'm absolutely not. I'm not going there. Ryan, don't go to that Atwater Costco.
I haven't been there.
And shout out to Pacoima with the wide lanes.
Yeah, that's a good
Great.
one.
Yeah,
That's a good
one.
Costco.
Anyways,
Right.
So, I'll start with the small things that's changed.
We just said one
uh,
thing, dude.
Oh shoot, one thing.
Just kidding. Go ahead.
Sorry.
small.
No, I know. Sorry. Let me rethink this. Okay. It is. I think it's slowed me down. I think kind of similar to how Elaine was saying. I was pretty much extroverted, but I think it's definitely slowed me down, and not necessarily in a bad way. In a good way, kind of made me like rethink and look at different perspectives. It's a lot deeper than I thought I would talk about, but it really made me think about life a little bit differently. Like I think being not married, right? Before, if this happened to me before, I'd probably be thinking only about myself, because I was always on the go. I was always like socially drinking, and I would not probably not care that much about the orders. I would think differently about it. I think that's what I would say, and I would be on the fast track to whatever. And I think this in this part of my life, I think it allowed me to slow down a little bit and think differently about all that it's done to affect us. Yeah, that's it. And I miss picking out my own steaks in the market.
What?
Wait, what?
Yeah.
Oh,
Like,
when you go
you
to
know-
a steak restaurant and then you
Yeah,
get to,
or like just a butcher shop or a market, like just to pick out my own meat to cook.
you can't do that.
You can't do that
Instacart
now? Oh,
Nope.
because you don't go inside.
I don't go inside. I Instacart everything, so if I Instacart something, it's like
Oh, I
it's
see
up
what
to
you're
them
saying.
to choose it. So that was a little thing, but anyway.
Joe, what about
Yeah.
you?
I think my biggest thing is not sharing my daughter to the world.
Just do a video thing like that.
It's different.
Lion King.
It's different.
No, I
Like
know.
even
It is.
when she was born, like nobody can come visit, and that was just so hard because like I remember visiting, friends who had their own children, and like it was such a precious moment, to like
Yeah.
see and meet them for the first time.
I
and, like,
know.
nobody
We
could do
haven't
that.
met her. I haven't
I
chomped
know.
on her legs, like her chewing on her
haven't,
fat thighs.
Yeah, when
Sorry.
I've seen her from a distance, it's just that I can't like hold her and Filipino auntie sniff her.
I want to
It
chew on her
is.
cheeks. Let me chew on your child's cheeks. That's my role in
Yeah,
life.
that's the main reason to get vaccinated, really.
I know totally.
And do it still through the mask. Well, like, chomp on her feetsies through the mask.
Yeah.
Okay, this is
Yeah.
weird. But
Giant
Wrap
shower
her.
curtain.
You can wrap her in saran wrap. I'll just,
I can't. You can't cover her nose though.
Oh, I know. I'll figure something out. Just wrap
I
up her
know.
thigh so I can just.
Or it will put like a plexiglass from the one half of her.
Oh, never mind. I'm not gonna say anything. That sounded bad. But yeah, that's been the biggest thing. Like, and obviously there's silver linings. I get to work from home, so I can take care of my daughter. But yeah, just like not having people come over and like play with her and stuff like that. That kind of just eats at me. So
Yeah. You know what is a big thing, and we don't really cover this in our talk with Cindy, but the fact that there's been such a rise of Asian American hate crimes going on right now,
yeah,
and they're affecting senior citizens, like that's like a big thing for me. And I'm not gonna lie, like I walk through the world in a privilege where I totally was just like, my parents are safe because they are home. They don't leave the house. Like I don't have to worry about that. But seeing these aunties and these uncles, like that one Tito that got slashed in the face and no one helped him. Like and the Tita in San Diego getting punched in the trolley and nobody helped her. Like, and the Tito in the Thai man in San Francisco where they freaking push, like, and the dude in New York. Like, there's too many things. Like, every day you see it. That, to me, that's a big thing that changed in our lives. It feels like recent, like in the past 2 months, 2 weeks, really, that the level of crimes against it sucks because they're elderly. Like, get the hell, how you're a garbage human if you're preying upon old people. Like, no, this it's terrible. That's one thing. Like, we didn't get to really talk about that with Cindy, but I just wanted to bring it up just to address it. But that's
totally important to bring that up. So thank you, Elaine, for that. I mean, we talk about our personal lives in terms of what's been affected us, but obviously we come from privileged places where this is definitely affected more people more severely than us, and we have to acknowledge that. But yeah, so thank you.
So we're going to talk about this lighthearted thing called COVID with Cindy Evangelista. Just this thing that's kept us home for a full freaking year. Cindy Evangelista is a physician's assistant, and we learned what that's about.
You're perfect at like segues, because I didn't know how to segue into that.
And you went right on in. I love it. Yeah.
I think it's a talent I learned thanks to visual communications and the fact that I have hosted enough panels that I make segues out of thin air. So that is where we're going. Thank you, visual communications. Thank you, Cindy Evangelista, for talking to us about what it's like out there in these streets, as our food appreciator says, as Ryan says.
Streets.
But yeah, so take a listen to the interview with Cindy. Stay safe, listen to that ad, and wear a freaking mask.
And show love.
Hey guys.
Hey, Elaine.
What's up, Elaine?
Did you know that we have TFALs?
Yes.
What's a TFAL?
I mean, what?
TFALs are our Patreons. They joined at patreon.com/TFAL podcast, and they support us every month.
Oh, is that what you announced, like one of our episodes, if there's a TPAL of the episode?
Correct.
So those people are Patreons?
Yes.
Cool.
Really? I actually thought they were random.
Are you serious?
Are you serious?
Mike is actually serious.
Wow, I'm learning something today.
Yeah.
And also all of you right now.
So if you want to be a TFAL and surprise Mike, join us at patreon.com/TFAL podcast.
But not only do you get to shout out on the episode, you get cool things as a TPAL, correct?
Ooh, like what kind of cool things, Ryan?
Like what? Like
Sometimes you get free giveaways.
oh, like what? Like a sticker?
Yes, like our logo sticker.
What?
Or our new TFAL Hearts OPM sticker that is inspired by Chicken Joy Division.
And you also get some free books if we get them from the authors. We'll definitely set aside some for our Patreons.
Correct.
And pictures of me.
I can
just
actually,
kidding. No,
I will.
What,
Now that-
exclusive Polaroids? Not that kind of Patreon, guys.
Numbered.
That's totally going to be a thing now. I'm going to take pictures of Ryan and give them to the Patreons.
But not only do you get all that, you also get some shout outs or say in some episodes.
That's true.
We'll get your opinions on certain subjects in upcoming episodes. And we'll also, as a new thing, we'll send you some blooper reels of TFAL. Only for the Patreons.
Only for the Patreons?
Only for the Patreons.
Oh, man. If you want some laughs, be a Patreon today.
Lewds, but no nudes.
But if subscribing monthly to TFAL is not your thing, maybe you can support us by giving us a Ko-fi.
Ko-fi? What's that?
It's a one-time donation to this Filipino American life.
Cool.
Yes. So either do Patreon or Ko-fi. What's the website for Ko-fi, Elaine?
Ko-fi.com/TFAL.
Ko-fi, ko-fi.com/TFAL podcast.
Yes. So thank you very much. Welcome back to This Filipino American Life. I am here. We are back.
Yes.
Welcome back.
Back from that break.
Yes.
Good break.
Give us 5 stars. Buy T-shirts. Give us coffee. All that stuff. Be a patron.
Make us do another commercial, please.
Oh yeah.
Oh yeah, we need to do another commercial. You're getting a little old.
Yeah, I'm like, well, there's 5 stars. We did this one? I'm like, man, we did that like years ago. So
These brown hands.
these brown hands.
Oh no.
So we are back from break, and we are here to talk about more about COVID.
What?
Yeah.
That's still going on?
Unfortunately, yes.
Oh my god.
Still going on.
Wasn't it supposed to be 2 weeks?
2 weeks.
Ah, 2 long weeks. What is this? Groundhog
Wow.
Day?
2 very long weeks.
We are approaching a year into the pandemic, but
Oh my
but
God.
here to talk more about COVID and all the safety precautions that we need to go through and kind of just experiences of the pandemic is Cindy Evangelista. Welcome.
Yay.
Yay.
Thank you. Thanks for having me.
Thank you for being here.
So Cindy, we have a question for you.
Make it
Yes.
deep.
What is a physician's assistant?
So, I happen to be a physician assistant.
Pop quiz.
So, you guys might know it as a PA or a physician assistant. And it's basically like an advanced practice provider or a physician extender. Maybe folks are more familiar with a nurse practitioner. So clinically, we're kind of similar in that respect, although we're taught in different models. The PAs are usually taught in the medical model, usually in a medical school, and then the nurse practitioner is in the nursing model and through nursing schools of nursing. Generally, the PA is at the master's level now, although it started in 1960, the actual occupation started in 1965 at Duke University, when one of the doctors decided to use some ex-military corpsmen. That's my Philip. Sorry, it's corpsmen. Not the zombie kind. The corpsmen.
I understood it though. I don't know about you
I
guys.
totally
That's
understood
how you-
too.
Yeah, I read it. I saw the word,
American life,
and
isn't
yeah.
it? I mean, so you know what I mean. So anyway, so we had a lot of these folks come back with a lot of training, and there are a lot of gaps in the healthcare system, even back then. And so they created this new occupation. It started off as like a 2-year program. It actually generally still is a 2-year program, although the program I went to at USC is 3 years. And it's a master's levels program now. We pretty much, as a PA, as the name implies, physician assistant, we're usually tied, at least at this point, to a physician. And we basically represent, in a sense, the physician. We take on the philosophy and the practice of the physician who we're working with. And any kind of, we evaluate, diagnose, treat patients, any kind of more complicated patients, depending on we bring up to the physician and kind of chat with them and kind of are guided by them. And so that's pretty much a partnership. If you think about like a PA having like a master's in medicine sort of, and the doctor having like a PhD kind of thing. So that's kind of how I sometimes like to explain it.
How did you come into your profession?
So, I've always been interested in medicine, and, as, Filipinos, or it's nursing or medicine, and, our usual. But I actually had a natural interest in it, aside from any kind of parental kind of influence.
What? People choose it?
I mean, right? Surprise. But when I went to UCLA undergrad with Kat, there was a lot of, I was kind of inspired by a lot of the social justice movements. And so I kind of diverted and I was trying to think of a way to kind of marry the social justice and health interests. And I actually first started, I did my master's of public health. And then while I was doing my master's of public health in San Francisco, I worked at a teen clinic because, we got to work and go to school at the same time.
Of course. Of course.
Right?
Yeah.
You got to eat. So I was working at Berkeley High School, like a teen clinic, and there was a PA there. I had never heard of one before. And she was pretty much running the clinic. And maybe once a week, the children's hospital doc would come in, check in on what's going on, and then she'd leave. And basically the PA would handle it all. And I was like, what is this? Okay. And then so she's like, you should do it. And she wrote me a letter of rec. And I got to do medicine, but the program is 3 years, not 4 years like medical school. So it's basically a abbreviated version. And, as a woman, not all women necessarily have this goal, but I also wanted to have a family. So it was a way to try to marry, we're always trying to find balance. And this is a way to like marry all those interests in a good amount of time. So,
Can you prescribe drugs?
Very cool.
I know
Yes.
it's a little tangent.
I mean, we'll talk after, but I don't know
Let
if
me
you need.
just put a little note here. I'm done with my question. Thank you.
I see your chat on the side.
Ryan always with the hookup
Hey,
kind of question.
I always need to know
Always the
these
hookup
things. You never know.
question.
Some of our listeners are like, PAs. Good to know.
Yeah.
All right,
Yeah.
done here.
I mean, actually, there's
Yeah.
like medical language, like the doctor prescribes, but we have a drug order. But as far as everyone else is concerned, we write prescriptions. So
So you
we're
talk
registered
about
with like the.
Yeah.
you talk about your passion for marrying social justice with the medical field, and we hear so much about like medical apartheid and how like it's so unjust and run by corporations. I mean, how is that battle of social justice going from your end?
Well, it's tough because, for my I'm actually going into my 14th year as a PA.
Congratulations.
And thank you. And my first 7 years are actually in community clinics. So that's one way, in different kind of community clinics in Los Angeles and trying to fill that need, with people who don't have insurance or whatever, for whatever circumstance. So that was a way to marry. But then there's also kind of, as you get more experience, you get more opportunities, right? And so, so now, I mean, and I also, after the community clinics, I worked in emergency rooms in like East Los Angeles and Mission Hills. So I'm still was dedicated to serving the community, like the communities where I come from, basically. But now I'm actually on the other end where I'm actually in a more corporate kind of environment, a big HMO. But now I'm dabbling in with the union.
Nice.
nice. Yeah.
So, where there's a will, there's a way. And if it's kind of inherent in your system, then that's kind of where I gravitate to. So that's how I'm able to kind of balance that.
Excellent. So now let's.
That's awesome.
Before we talked about COVID, any other questions before we talk about COVID? All right, so let's talk COVID.
Oh, yeah.
A
What is
lighthearted
that?
topic.
Just kidding.
I know.
What is that? Just kidding. How do you spell
My
that? No.
face. Look at my face. It's been rough.
Nervous laugh for me.
How has it been in the field? Like, how's it been in the field this past year for you?
Well, it's a lot of ups and downs, honestly. There's a lot of like unknowns initially because I was working in the urgent care, and unlike some places that kind of closed down the telephone appointments, we were there live, and when we weren't even sure how it was being spread and so forth. So there's a lot of like worry and concern initially, and we had to, even though we're working for a pretty large organization, we had to get our own PPE. and we had to like go on Facebook and raise money and, try to find PPE. So that was really scary. And after a while, you get into it and, you're able to kind of get the flow of it. And then, I don't know, it's at this point, it's kind of burnout, if I can be truthful about it.
Imagine, yeah.
And, I can't speak for everybody, but just kind of in general, it's been tough to keep hanging on and everyone in general, but it just feels never ending. And but I'm grateful that I have the opportunity to do this. Is why I went into medicine, right? So to help people, and this is like so important, and it's the reason I'm here. But I can't lie and say I'm not tired.
Yeah.
But yeah.
Plus being a mom and a partner and a family person on top of all of that.
Yeah. I mean, the thing is, it's like you want to serve and you want to help people, but then really you're scared to bring it home. That's like the biggest, like, oh, who cares about me? But, I mean, I care about me, but, if I bring it home, that's what the big fear was,
Could you tell us a little bit about like what your practice would be, like what your home practice would be to kind of, keep it preventative from or protected from your family?
So we had to fight to get like, scrubs at work. We're like, I don't want to wear use my scrubs there, and then come home and use the washers. We got scrubs. So I go over there and I change into scrubs and I change out of those. I come home, kids know, don't come hug mama, don't come kiss me, nothing. I go straight to the bathroom, my own bathroom, where no one else. Actually, was it Lacan or my daughter put up a sign, COVID bathroom? I don't know. I didn't have COVID.
Dang.
So it's basically a warning sign. Don't come in here, because I go straight in there. I take a shower, and then initially after the shower, I'd be doing like spraying the whole tub. I'm not doing that anymore. So obviously, if we take off our shoes, I'd actually switch off my shoes. I wouldn't go in the car with the shoes I work. So, yeah, a lot of just little things. Mm-hmm.
So does it feel like kind of clockwork now? Because it's just something you've been doing for the past year.
It's clockwork now. I think, I've accepted. Initially, I was worried that it was airborne versus like droplets. And so, I was feeling a little more comfortable. I kind of know how to, and plus I got vaccinated. So that helped.
Yay.
So yeah, we're not as stringent, but I still I took a shower. Luckily for you guys, between work and here.
Thank you. Wow. Well, that's cool. Okay. Well, so this being this Filipino American life, we've been hearing a lot of the media attention that has come around COVID and Filipinos is how Filipino frontliners, nurses, are named specifically, but, over-index in the infection rate of frontliners. So that's definitely one thing that we've read about and heard about. But we'd love for you to talk a little bit about, just because, you and knowing you for years and your love for community and, it's even informed your work. How does, talk to us a little bit about the intersection of COVID and Filipino culture and being Filipino. Like how does it influence your work, or how have you seen it show up? Or, we'd love to know your perspective and observations and reflections on it.
Well, you brought up a couple keywords, Filipino nurses. This is still, like full on, true. We work in the service industry and there's a lot of, I may not be a nurse, but there's still a lot of Filipino nurses. And so, we're service oriented. We're highly trained and highly experienced, not just in the clinical aspect, but in terms of, knowing how to care for others. in that kind of context. Granted, we're not alone in that, but I'd say it is important to reemphasize that nurses have been Filipino nurses have been disproportionately affected and fallen ill and even died from COVID. And not as so in the workplace. I mean, you're thinking about COVID spread in the community, but in the workplace, we're still social. We want to share our food,
Yeah.
right? In the break rooms, we want to be there with each other and talk with each other and loudly sometimes and laugh. But you can't really do that. They because they're spread in break rooms now. I mean, so that's that's a little bit difficult. I think it so happens I am now working in a cardiac cath lab, and I work with a lot of Filipino nurses, and honestly, I feel like very protective of them, and they're actually they're older, and I'm the younger one there, and I'm not so young anymore, and so I'm very protective of them, and just kind of making sure that there's the proper PPE, N95s, because it's not comfortable, or it's I'm just gonna wear never mind, it's okay. I'm like, no, I say manang or ate, please. And, please wear it at least for this patient, please, so, yeah.
So not to out.
Wow, that's really big. Sorry, Joe,
fine.
but I just feel like because I could see how you can let your guard down because you're tired, like you were talking about, and at any moment. So that is and to also have that, because we also have a very cariño culture, right, where it's like you kind of sometimes you step back and you don't want conflict, and so it's really great that you step in and are like, you've got to do it. I wish that's something that is always going to be nerve-wracking, whether in the hospital or not, like with your loved ones, right?
Right.
So not to out anybody, but I wanted to know, I mean, we hear stories about a lot of maybe our uncles and aunts still gathering together in parties, and all that stuff.
So can you out people, Cindy? Is basically Joe's answer.
But we hear that.
Sorry, Joe.
And fucking Ryan, dude, I lost my train of
I'm
thought.
sorry,
now.
I didn't make me to do that.
Tangina.
So the people who are socializing at home or
Yeah. I mean, have you encountered that amongst people who you work with, and maybe not even just people you work with, just people in general. What do you say to that?
So it's really tough because I don't want to, because I know as humans we're social creatures.
Yeah.
And I'm not trying to be mad at people for wanting to be around each other. It's in our nature. It's in our culture in a lot of aspects. So, yes, I have experience, with our family, friends, family, friends, or even coworkers who, still want to hang out and get together. But then I look at it as the virus, right? I have more a scientific lens, which I admit, that's not everybody has that kind of, or wants to have that kind of lens. But, the virus, it needs a host, right? Mm-hmm. So it needs a host to reproduce. And it's evolved through the millennia with, through the centuries with us humans. And that's how it's able to spread, because it takes advantage of our social nature, right? Because we share air with each other. We share food. So, and as much as that social aspect, is a strength for us, but there's also this virus that takes advantage of that. And so I think I approach it more as just giving kind of an education as to like transmission, and then having people have to decide on their own. People have to decide on their own amongst their families, friends. Granted, I'm like, please don't end up in the ICU. Please take the precautions. Because if you're in the ICU, people say we're not frontliners. Like, we're not at the front, we're at the end. So if you see us, we're not like at the front anymore. That means you've already broken through a few hurdles to get to having to be in the hospital and see us.
Yeah.
We're probably, we might be the last, not the first liners.
Yeah.
So I try not to get into too much, judgment. And, people have their own unfortunately, it's kind of become a political issue. This virus, does it exist? Should we wear a mask, not mask? And all I can do is I can just say from my perspective and from what I've seen and what I've learned, and I share that. And the rest is for other people to decide.
So this is kind of like personal anecdote, but in I'm gonna out my dad as he got vaccinated.
I did
You're
it.
so brave.
He got vaccinated.
Very good.
He got his two I was joking with Joe that the side effect of his second vaccine was a strong urge to go to Costco, and and arm pain and itchiness to go to the racetrack and Costco.
Oh,
But
I've heard the casino too.
that too. I think my dad's 80, and I think in general we, I think my dad and maybe his generation has just a different outlook upon a sickness. I don't know what that outlook is, but the way we explained it to him was really more about the spread. Even though our main concern was it affected a lot of older people, right? It affected them a lot worse than not if you're not of that age or if you don't have any pre-existing conditions. But I think to him, he's like, not that he didn't care whether or not he got infected, but like, I'm 80. To some degree, that's what he was thinking. Yeah. So the way we explained it to him was more like, hey, you could be a carrier, you could be a spreader. And I think it changed something in his mind a little bit. That he could infect my mom, who he's giving care to, or even one of us, because my dad was notorious for like sneaking out and going to the market. He'll wear a mask, but like he won't. He lives with with my mom and my brother. My brother would always get mad at him for sneaking out because and we tend to do these sneaky things in terms of gathering. We figure out what the rule is, right? Oh, 6 feet, I can do that. Oh, we can drive to other people as long as we stay this. Oh, we're outdoors, And so I think we find ways to. You're absolutely right, to be social and we're never quite at fault, right? Because we're doing everything we can. But I think if I had a message for people too, based on what you're saying, Cindy, is that we have to do more than what we think we can when it comes to something like this. And I think that's what I've learned throughout all this. Like, we got to be nerds about it. We got to be a little bit more sort of obsessive about not gathering and all that. So it sucks because we're Filipino and we missed a lot of the gatherings, especially during the holidays and especially visiting people in the hospitals too. A lot of people were very alone in hospitals, so it's this thing sucks. I know I was joking around earlier about it, but it just like took every social and fun aspect of life, and just drained it out, and it just sucks. Even like the little things that happens in hospitals, it just took the way we give as Filipinos, the way we care, like even the caregiving that that a lot of Filipino nurses and nurse practitioners and even PAs give, and that extra care that we know we can get from Filipino personnel. It's like
Yes.
you can't, like and that's the part that hurts, because no matter how good and how much we want to give, we couldn't. It was taken away from us, and that was the hard part. Sorry, that went longer than I thought. Anyway, just sharing.
No, thank you. I mean, that's excellent. It's interesting what we wouldn't do for ourselves, but we're willing to do for others. Which is what your point is about. Dad was like, oh, I'm 80, I'm just going to live, which I can't blame him, But then he's like, oh, but if you infect other family members and this and that, which is, again, if you're talking about Filipinos, that kind of triggers, us too. So what I'm not willing to do for myself, like maybe I'm willing to do so that the rest of my family won't suffer,
I have a kind of a tangent question, but we're over the proverbial hill of the pandemic. We're having they're distributing the vaccine, although it's very slow, right? But there is a vaccine out there, and we can kind of see the light at the end of the tunnel a little bit. So I had a kind of a dilemma in where I was offered the chance of quote unquote skipping the line to get a vaccine. But
Do tell.
so I don't want to go into the details, but basically,
So basically, you're not going to tell us if you did it or not.
no. I'll tell you that.
You can tell the other part too.
I just won't let you know exactly how I could have gotten the vaccine, but
Okay.
me and Gurley decided not to get it because we felt like it was cheating and jumping the line and all that stuff, right?
That's very noble of you, man.
But now I feel like, damn, do I regret it now? Like I think I regret it a little bit because the distribution of the vaccine has been so awful, so crappy that maybe I should have got the vaccine and I would have gotten one. Like my biggest fear was that I could have got one instead of someone else. But then I just hear all these stories now saying that they might lose or they might waste the vaccine, so it might as well. I don't know. What do you think of people possibly
Skipping
jumping the
the line?
line of getting the vaccine?
Well,
Is this open to everyone, or?
I think
Well, no, it's open obviously to our expert.
Yeah.
so. There's a reason for the priority. How they've broken up the vaccine into the highest priority, highest risk age group, and like comorbidity groups. So, for now, I would say thank you for thinking of other people and skipping the line. But I do think as soon as it's available for you to get that vaccine, and the problem, unfortunately, is that we don't have enough vaccine. And it's not so much like, skipping the line and all that. But thank you for that. Like, that was a noble thing to do. My brother, who's actually a RN, surprise, he's a nurse, but he works online, not direct patient care. And he also, even though because he's a nurse, he can get that vaccine, he actually also skipped the line, didn't get in line until other people who needed it more dire, in the high priority groups got it.
Wait, how come he wasn't a high priority even though he was an RN?
Because he's not in a direct patient care. He does like case management, and he can like through computer work from home.
Oh, got it.
Mm-hmm. Yeah.
See, Ryan.
So, Joe caught me in a vulnerable moment. He texted me, and without hesitation, I said yes. I would do
Yeah.
it. And he asked me again. He goes, really? I said, yes.
Yeah.
And then he asked me again. But even if it meant taking it before someone who's like older, I'm like, yes. I think I said yes 3 times, and I was like,
My thing is
Yeah.
because these need to be refrigerated and whatnot, like the vaccine. If it's going to go bad, you might
Yes.
as well have it be
Yes.
used instead of it going bad.
100%.
But that wasn't the case.
yeah. That's why we ended up concluding that it matters what the loophole is.
Okay, so not gonna lie, I'm taking my mom to get her vaccine on Saturday, and like of my tita generation, she's like the
gonna
last
sneak
to
your arm
get
in
it.
there, Lee?
No. So legit, because I'm taking on the role of her caregiver, right?
Yeah.
I'm going to ask the people when I take her to the big HMO that possibly Cindy works for.
Rhymes with miser.
I'm going to ask and then be like, look, I'm taking on the role as my mom's caregiver. I'm a type 2 diabetic. I'm above 40. I work in education. I work at UCLA. I'll bring my staff ID. Is it possible for me to get my vaccine the same time as my mom so that we are in line, like we are in step? And the worst they can tell me is no. And they tell me I got to come back, which is fine. I will absolutely do that. But Cindy, I just want you to know I am going to ask and see what
I
they say.
ask. Yes.
Yeah.
I mean, you know what? I'm not like, if I would probably, want to like get in line too and get my vaccine. I mean, so I'm not gonna, tell people not to get it. And if there's any vaccines that are wasted, I put it in someone's arm. Like
That's right.
whoever's there, put in someone's arm. But if you are going to the large institution that you're might be alluding to, try to get that appointment, even for your mom. Make sure, I think, because there was walk-ins, but there might be appointments. Not anyway.
Oh, she has an appointment.
Okay, perfect.
So like,
Perfect.
yeah, I'm purposely, my tita already went and she's like, you go early. Our appointment was at 11. We showed up at 9:30 and they saw us already. And I was like, 9:30? But
It's
that's
like
my
the
tita
airport.
style. She goes hella early. It is like the airport.
For sure. I mean, hopefully we won't have to be picking and choosing soon. I mean, but anybody
There was
else?
that case of the doctor who like knew that. I think it was a doctor that knew that like they had like a batch that was about to like just expire if they hadn't just used it, and like
Yep.
it just ended up like vaccinating himself and his family because they were the closest people who were most available, and like
Yeah.
rather than just throw it away, why don't just use it?
Yeah.
And like he ended up like getting fired or something. I don't remember the whole story, but I mean like, there's gonna be a lot of these situations where it's like, well, what's worse, like jumping the line or letting it go to waste? And like, yeah, those are like judgment calls
Right.
that will only happen on the spot until, we come up with a better method of distribution, a better method of like storage, better everything. I mean, like, I'm definitely gonna get vaccinated when my turn comes. But yeah, like I think we're all just trying to figure it out. And I don't know what I would do if somebody was like, hey, why don't you come into my white van? I have a vaccination for you.
Just make sure it's the
Like-
vaccine you're getting and not something else.
I know, totally.
Or if like, Tito Vax calls me and says like, oh, we have a spare in the back. Just come by.
Man, and our peoples, they
I
will
know.
find, I love our peoples, but they will find some kind of way.
Resourceful, right? Resourceful.
Resourceful, yes.
Cindy, do you have any like tips about like just how to deal with COVID? Because I had a birthday Zoom because that is how the life we live now.
I know, right?
Everything is a birthday Zoom. And my homie, who was the most careful of all of us, he hasn't been inside a grocery store. He hasn't gone to Target since last March. He gets everything delivered via Instacart, but he has been going into work. He's a lawyer and he had to do billable hours. So he was in there. So he got
Yeah.
COVID.
Yeah.
And of all of us, of our circle of friends, he was the most careful. And he told us it was just brutal. It was like the worst. And then like, no joke, I think I felt a little bit of survivor guilt because, I'm careful. I've been wearing a mask all the time. I have hand sanitizer with me. Mike bought KN95, so we've been using those to be like hella like, I'm going to have all the filters. But I still go out, right? And I'm still going to the grocery store. I'm still all this shit. But my homie who'd Instacart life, always delivery, he's the one that got COVID and then gave it to his partner because they live in the same house. And I'm like, dude, the guilt that I have because I've been going to Target.
Yeah.
And I know
I've
Kat.
been like wilded out there compared to like him anyway.
And I know Kat and our other homegirl, Costco is their life.
We go to Costco.
That is their social.
Yeah.
Well,
I mean, we're masked when we're with each other, but we go to Costco regularly. I've been testing negative.
I mean, you gotta eat
the whole time.
and not everybody has the resources of just ordering online, or like there's different reasons, and and it's I don't want to put like judgment on people. Oh well, because you did this, then that's why you have COVID. You know what I mean? And and you no need to feel guilty because you're also doing the best you can. That's all we can do is the best we can. And then your friend had to go to work, so like to make a living. So and this virus is just so prevalent that it just sometimes you just don't know, and sometimes people might get no symptoms, some people might get mild symptoms, and some people get severe symptoms, and some die. And I can't really even understand it. I try to read up on the latest journals and like scientific journals and medical journals, and just what I see in the hospital is like 1 minute you have someone with like breast cancer and renal cancer and had a mastectomy and a partial nephrectomy, and she's positive COVID and just chilling, and she's like 65. Then there's a 40-year-old who's a runner, who like a marathon runner, who's like a vegan, and they get sick, and I don't know. I can't explain it right now, and so that's why there's just this, unfortunately, just a general mass approach, which is just we don't know, just put on a mask until we find out more, So we're
Like
just kind
legit.
of
Like legit mask, wash your hands, social distance. That's what we should be doing. That's the Fauci method. Like we're all like just listen to that and we'll be good.
Yes. Number one, public health. Yeah, because it's about transmission, right? And so you're trying to put barriers to the transmission. So when someone is talking, so the virus, is spread through droplets or micro droplets. So the 6 feet is because that's where they estimate how far a droplet will go and can land. So that's why the 6 feet, right? Why they say to in an open area is because when you have an open air, these droplets get pushed around, and so the density, the exposure to there's less density of exposure to you if there's a wide open space and the droplets go everywhere, versus you're stuck in a room and you're singing, which and you're like, which makes it further go up further. It's just the science of it. It's not like because like, oh, we don't want you to be next to each other.
Right. So no karaoke.
Or bring your own little microphone.
Or bring your own.
Yeah.
Or bring your own mic.
half-baked idea.
Hey, TFAL.
Well, we've had like a couple episodes talking about preventative measures and the inventions that we've came up with to prevent people from having COVID. You could rehash that episode, or we can go back to that episode to listen to it. But given we talked a lot about preventative measures. What happens when you get COVID? What do you do? What should you do?
So, again, one thing is, how do you know you have COVID, right? So, there's the whole concept of, you don't know you've been exposed, or you don't know. So one is like you're either pre-symptomatic, meaning you've been exposed, but you haven't gotten the symptoms yet. The other possibility is that you've been exposed and you've been infected, but you just have no symptoms at all. But when you, so I kind of break down how, if you do end up with COVID or COVID symptoms, I kind of break it down into like the mild and moderate symptoms, which is, let's say you have body aches, you have fever, sometimes people say a loss of, sense of smell. So those are things for one is you should get in contact, at least a telephone appointment with your primary doctor, your physician, just to let them know where you're at, get them aware of what your symptoms are. And then you have to monitor yourself. So if you have, body aches and you have fever, we tend to favor more like Tylenol for fever and body aches versus acetaminophen. And, I have to make a disclaimer too, that this is just totally just general, medical, it's not medical advice because everyone is different. You should listen to your physician or your physician assistant or nurse practitioner. But, Tylenol is favored over ibuprofen or, because there's still some studies not completely sure yet if somehow the ibuprofen is a little bit not as good during COVID, but if the Tylenol is not working, otherwise known as acetaminophen, then you would, try ibuprofen if you don't have any issues like kidney issues or if you're not pregnant, whatever other kind of things. The other things, if you have a cough, and you could try like a dextromethorphan, kind of like when you remember Robitussin DM. So the DM part is like dextromethorphan, which is over the counter. Tylenol is over the counter for cough. There's some studies that haven't really been proven that, vitamin D or maybe zinc or ascorbic acid, but those are just kind of supplements that hasn't been completely proven yet. Now, what for those are for the mild symptoms. Now, these are for folks who are not in the high risk kind of category. And I wrote down here so I wouldn't forget the high risk category. Basic chronic medical conditions like chronic kidney disease, diabetes, kind of immunosuppression like cancers. If you're over 65, you have COPD, hypertension, or if your BMI, your body mass index, is greater than 35. There's actually they don't people with higher BMIs. I'm not saying my BMI is low either, but people with higher BMIs are actually higher risk. Yes.
Yeah. Will they just
because you got to breathe?
Will they just look at you and determine whether or not you're obese?
It's actually a medical. They base it off your height and your weight.
I was being facetious.
No, you gotta go by the lechon index.
Oh, sorry. The lechon index. So if you have more than
the size of
2
your
pieces
panza index
at a time.
So I also had
it's actually just,
another question. This is of a personal nature. I saw that the governor of California has allowed at least the next priority level of people to get vaccines. People who have type 2 diabetes with A1C over 7.5.
Loophole.
Do you recommend?
I don't have a 7.5 A1C. I'm not going to eat a whole loaf of bread just to get that.
Yeah. Do you recommend me doing that?
No, we're all spiking it. Oh man.
Sorry,
index.
This is horrible.
If you have an opportunity to get the vaccine, it's hard to control. It's really up to you. I mean, there's a reason for the priority list, but if you have an opportunity for whatever reason, the vaccine might go to waste. If not, then, if you don't have any contraindications or anything like that, then, hey, I'm not going to tell you not to, because I know you want to protect yourself and your family and so forth. But think about this. You're not the only ones looking for loopholes. I know a lot of, politicians that are getting in there, right?
Of course. So I can eat all. I can have a carb fest. And
Oh my god.
Oh, Joe is basically asking, should he make his A1C 7.5 so he could go get the COVID vaccine?
No. Anyway, because then now you're putting yourself at risk for for COVID.
See? Oh, Nux. You don't want to put yourself at risk from
Yeah.
COVID.
duh.
Just to get a
gotta-
vaccine.
He's like,
you
oh,
know,
yeah,
it's
that
just
part.
kind of, you know.
Stay below 6. Yeah.
Yeah, 6.5 is the point of diabetes.
Oh, really? See, I am below it.
Oh, good job, Elaine.
Oh. Yeah.
Good job, Lainey.
My BMI might be
Yeah,
above
6.5.
35, but I am below 6.
Girl. You know,
Let's show
For the
index,
win.
man.
For the win.
Oh, now everybody knows I'm fat, but I have a good blood sugar level.
you know, just be healthy. Just try to be healthy. That's it. You know, that's it.
All that matters.
You know.
Yeah.
Yeah, that's what matters.
So in terms of being healthy, I kind of wanted to kind of encapsulate this chat with being healthy, because as much as COVID has impacted our lives this past year, you know, from personal experience and because of all the health issues that like my family has had, but it really did impact the way we looked at health. And what I mean by that is, regardless of whether or not you had COVID, a lot of people forgot or didn't pay attention to how hospitals were impacted by everything else, and how COVID impacted the ICUs and all that stuff. And I think people misunderstood sort of like this, you know, flatten the curve thing, because people were sort of misunderstanding that a lot of it had to do with our capacity as healthcare providers and the capacity of the places that provide care. So I did want to sort of help wrap this up with this like a healthy note, Cindy, and thank you for doing that. It's like, be healthy and try to be healthy. I'm trying my best to be healthy. You know, like giving up stuff during Lent. I don't know. I need something, right, to do that. But if we must need different pushes, whether you know it's a religious holiday or Lent, I encourage people to do that. So I'm giving up sweets, all Lent. I'm giving up soda every year, and so you know just little things like that, or walking more, or adding, you know, fiber to your diet, or anything like that. I know this is not really a COVID topic, but I think being healthy is something that we all should strive to do.
Yes,
so that we,
baseline.
you know, yeah. And anyway, so I just wanted to sort of go with that. But Cindy, thank you so much for joining us. This was
Thank you.
you know, we poked fun earlier about COVID. It's still a very serious thing. So I know that there's a lot more to do out there. So I'll continue to do the safe practices, I think. But any last words from the panel?
Stay safe, wear a mask, wash your hands, stay 6 feet away from me. It's probably safer because I'm usually crop dusting, but you know, just saying.
Oh my God. Elaine, you're
Just being open and free.
apparently.
Yeah, and Cindy, thank you for your insight. I think it's very important that we have someone who is, you know, committed to our community and who has, you know, a lens of social justice and community. I think, you know, really hearing from you about let's not judge each other. Let's, you know, help each other and stay informed and stay healthy, I think is really just great messages to put out there during this, you know, still relatively grim time. So thank you.
Thank you. And don't forget the mental health. Okay, so that's a whole nother. That's important. And so yeah, do your best, you guys. I know it's tough. There's the science, but then there's, you know, we're human and we're imperfect, and you just do the best you can. Whatever little steps, little choices that you make, do it. You know, we'll get through it.
Thank you, Cindy.
Cool.
Thanks, Cindy.
Thank you, Cindy.
Thank you.
This Filipino American Life is produced by Michael Nailat. Our intro and outro music is by Roger Habon, aka 10.4 Raj. resident reality checker Girly Colado, legal advisor Rianne Fajardo, and graphic design by Vincent Collyer.